When I'm talking to professionals about the family illness of alcoholism, I describe that, to begin with, alcoholism has many symptoms. And one of the symptoms is that it affects relationships. It affects relationships with spouses, it affects relationships with kids, affects relationships with physicians, and many physicians recognize that immediately. But spouses and children are often stressed a great deal in ways that fall into two categories, really. One is oftentimes they can be the victims of meanness, cruelty, and abuse. But the other way is that they often become the caretakers. And the kind of syndromes that you see in caretakers of people with other kinds of chronic medical illnesses overtake the family members. So that you often see that the family members are beginning to neglect their own medical care as they begin to focus all of their time, all of their energies, all of their attention on the alcoholic, trying to help the alcoholic get by when the alcoholic is neglecting their own care.
Denial is the number one thing, it's the number one feature of the disease of alcoholism. And with the denial becomes the ability to blame. And so in a family where there is alcoholism present, blame is always a key factor within the family. The alcoholic wants to blame everybody else for their behavior, wants to blame everything on other people so they can justify continuing to drink. And the family, of course, has the luxury of being able to focus on the alcoholic and blame the alcoholic for all issues going on within the family. As a clinician, if you're working with adolescents and you're starting to wonder if they're in this system, one of the things that I look for is how shut down is the adolescent about the family that they come from. A lot of times there's so much blame going on that the family acts almost as a cult, to where they're not allowed to talk about it outside the family. And so as I gently start to explore with clients and families about what's going on in the system, when they're reluctant to talk about mom or dad's drinking, and when they're reluctant to talk about the feelings that are going on in the family, and when they're reluctant to talk about what the dynamics are, that's always an indicator to me to explore that a little bit further. And once the kid opens up and begins to talk a little bit more about it, you can start to explore, well, how much chaos is there in the family? And how difficult is it to make sure that things stay peaceful and calm in the family? And generally by that time, if you can get them talking about that, then the kid will start to explain where the chaos is and how much work they're having to do to try and manage the chaos within their family to keep everything from blowing up at any given moment. And they find out, the clinician will find out, that they're actually spending a lot of time trying to keep things on an equilibrium basis and keep everything equally within the family. They are good candidates to go to Alateen.
If you're a professional working in the field of addiction, or even not in the field, you're just a professional helping people, one of the things I would ask you to do is, first of all, move away from the pathology of the family system and move into what is the resiliency of this family. What are the strengths of this family? What are the gifts of this family? And what are the things that are working well, so that you can invite that family into opening up about what's really going on. And what's really going on in some cases with the families that come to you is addiction, active addiction. But it's couched in other terms. The person may be coming to you because they're having marital problems. They may be coming to you because the children are acting out. They may be coming to you because they're depressed. They may have a series of symptomatic pieces that they're presenting to you. However, the underlying piece is that there's alcoholism in that family system. And you may not see it right away yourself because that's not how they're presenting. So the obvious question is to ask, is there drinking going on in your family system? Is somebody in your family in trouble with alcohol or drugs? It's a simple, straightforward, direct question to ask any family member who comes to you. And never assume that these other presenting symptoms are what's going on, that they may be secondary to the primary illness of addiction.
Alcoholism can live far past when the alcoholic decides to put down the drink. It just takes on different forms. So what we see is that the family doesn't know how to make boundaries. Parents describe their children as best friends. Kids become what we call parentified. They take care of the parents instead of the parents taking care of them.